Hi, my name is Jakara Henry Hand, and my course project report topic is congestive heart failure. So, congestive heart failure is a chronic condition where the heart cannot pump blood well enough to supply the body's needs. This causes blood to pool in other regions of the body and leads to low oxygen delivery, since hemoglobin in the blood is the body's main supplier of oxygen. There are three types of congestive heart failure. There is left-sided CHF, where the left ventricle is not pumping well. This makes the left side of the heart struggle to get blood to the systemic circulatory system, also known as everywhere else in the body. Right-sided CHF is where the right ventricle is not pumping well. In this instance, the right side of the heart is struggling to get blood to the lungs. In biventricle CHF, both right and left ventricle are affected. In left-sided CHF, there are two subsets. There's systolic CHF that happens when the left ventricle can't contract with enough force. So this leads to poor circulation and a reduced ejection fraction. And ejection fraction is the amount of blood that is pumped out of the ventricle with each contraction. In diastolic CHF, this happens when the heart muscle becomes stiff. So the ventricle is still contracting normally, but it can't relax. So this causes the heart to not be able to fill up with enough blood. And biventricle heart failure is rare, and it shows advanced heart failure. Symptoms of congestive heart failure depend on what kind you have. There are general symptoms that are present in all cases of CHF, and they include chest pain, shortness of breath, heart palpitations, which means like random heart or fast pitter-patter heartbeats, and fatigue. So in left-sided CHF, you're going to have things such as orthopnea, which is difficulty breathing while laying flat. And this is alleviated by sitting upright or standing upright. You also have restlessness. There's confusion. There's dyspnea, which is difficulty breathing, like shortness of breath. And cyanosis, which is a bluing of the skin. Cyan is the blue color. And this is from poor circulation to the extremities. In right-sided congestive heart failure, there's bloating, anorexia, which is short for anorexia nervosa, anorexia meaning no appetite, nausea, edema, which is pooling of fluid in the extremities, distended neck veins, cool legs, and oliguria, which is reduced urine output. So diagnosis will begin with a physical exam. This includes heart and lung oscillation, which is listening with a stethoscope to the heart and the lungs, as well as checking for edema by palpating the extremities. During the physical exam, the physician or cardiologist will look for signs and symptoms of congestive heart failure. For example, lung crackling heard during oscillation is a trademark sign of congestive heart failure. The lung crackling is also known as pulmonary edema, which is pulmonary for lungs, edema for fluid pooling. So there is typically blood in the lungs. Their blood testing is also involved in congestive heart failure diagnosis. A sample of blood is sent to a lab and tested for biomarkers, as well as a panel to see how the other organs are functioning. So in addition to those biomarkers, there's a panel, which includes a check for electrolytes, albumin, levels to show liver function, and creatinine levels to show kidney function. By looking at the function of the other organs, this can show how advanced the heart failure is and if it's affecting other organ systems. Along with the physical and blood work, there are a few diagnostic tests that can be performed to diagnose congestive heart failure. The first one is typically an echocardiogram, also known as an echo. This is where a physician uses sound waves to look at the heart's structure and motion. By looking at an echo, this allows the cardiologist to see how well the heart is pumping, the heart's ejection fraction, and the condition of all the heart valves. The next step may be an electrocardiogram, also known as an EKG, which records the heart's electrical activity via a heart monitor. An EKG will show if the heart rhythm is abnormal, the timing of your heartbeat, and if the left ventricular muscle wall has thickened. The cardiologist may also order a chest x-ray to be performed using radiology to give the physician an image of the chest. Using this image of the chest, the physician can look and see whether the heart is enlarged or if there is congestion of the lungs, aka pulmonary edema. This will also rule out if something other than heart failure is causing the symptoms. So the physician then takes all of the data that he gets from these tests. I forgot to mention a stress test may be ordered as well. A stress test will tell how the heart works while the body is in motion, and this will give the physician a accurate model of your heart through day-to-day activities in life. So then the cardiologist takes all of this data and they look at it in order to place the patient in a stage of heart failure. So there are 4 stages. There is stage A, which is pre-heart failure, which is classified as pre-heart failure, which is a person who is at high risk for developing heart failure because they have a family history of congestive heart failure or a condition that causes comorbidity. Comorbidity is when two conditions contribute to a disease. And stage B is when the left ventricle is functioning abnormally, but there are no signs or symptoms of heart failure. So the test may come back and you've told the doctor that you don't have any symptoms. You've been feeling fine. You've been feeling great. But the doctor sees that your left ventricle is not functioning right. So they'll place you into stage B. In stage C, this person would have already been diagnosed with congestive heart failure and have or had symptoms. And then there is stage D, also known as reduced ejection fraction. This person has advanced symptoms and they do not alleviate with treatment. This is known as the final stage of heart failure. So as far as treatment, you have to know that congestive heart failure is a chronic condition. There is no cure. Medication and lifestyle changes are the main types of treatment. So the stage of heart failure also contributes to the treatment decision. So for stage A, you would most likely get instructions to change your lifestyle in areas like incorporating exercise, quitting smoking, a diet low in sodium, things like that. You may also be given medications to lower blood pressure, such as ACE inhibitors. So for stage B, you will incorporate the things from stages A, but you will also be given an ARB or beta blocker. You may or may not, if your ejection fraction is lower than 40%. For stage C, They would incorporate all the steps from A and B. However, the beta blocker and aldosterone antagonist are not optional, and you may be given many more medications as well. For stage D, since it is considered the final stage of heart failure, these treatments are typically last resort, such as heart surgery to fix valves or ventricular assistance devices to help the heart pump, or even a heart transplant. There is also the option of hospice care or palliative care for patients who these options are not right for, or they choose not to take them. Hospice care or palliative care keeps a person comfortable and tries to manage their pain throughout the end of their life. It is very possible to live a good life while living with congestive heart failure. It all depends on the patient and sticking to their treatment plan. One study says that people with congestive heart failure have a lifespan of 10 years shorter than those who don't have congestive heart failure. That's from the Cleveland Clinic.